Assalamu alaikum and good afternoon. I am Dr. Jasmine Ara Haque, the former director of Institute of Nuclear Medicine and Allied Sciences, Dhaka Medical College Hospital. I'm also working with Society of Nuclear Medicine Bangladesh. I'm the vice president of there, and I'm the Secretary General of Bangladesh Society of Ultrasonography. So, honorable chairpersons and respected audience, the title of my presentation is Assessing the Cytogenic Impact of Iodine 131 Therapy in Thyroid Cancer Patients. Thyroid cancer is a rare, relatively common endocrine malignancy. It affects millions of people worldwide. Different types of thyroid cancer exist, with papillary thyroid carcinoma being the most. About 85% are from papillary carcinoma, 8.2% follicular carcinoma, 1% from medullary. Undifferentiated carcinoma is from 0.8 and 4.5% from other thyroid cancers. In Bangladesh, about 20% population suffered from thyroid disorders. Chromosomal abnormalities are frequently observed in thyroid cancer cells. We are treating this papillary and follicular variety of thyroid carcinoma by iodine 131 therapy, and this therapy causes toxicity to the bone marrow and other abdominal organs. And by radiation decay, these radio decays are beta particle 90% and gamma ray 10%. The half-life of the radioactive iodine is 8 days, and it depends, the physical half-life, biological half-life, and effective half-lives are depending on the subject. That is, the physical half-life is 8 days, and for infant, it is effective half-life is 5 days. For 5 years old, it is 6, and for adults, 7 days. So the radiation decay causing change in the chromosome. So what are the changes? The changes are the single strain base break and the double strain break, or it can be base or sugar damage. And this DNA, that is protein, the DNA and protein crosslink is one of the variety, and it can be DNA inter-strain crosslink, and it can be DNA inter-strain crosslink. So radioactive iodine uptake in the patient may cause normal repair, or it can may cause misrepair. The misrepairs are stable aberration and unstable aberration. The stable aberration are translocation, and the unstables are the dicentric and ring formation with the formation of fragments, and also can causes micronucleus formation. And these abnormalities can disrupt the cell division and potentially control to genomic instability. So the major cytogenic biomarkers are the dicentric, ring, translocation, and micronucleus. So why chromosomal abnormalities, aberrations study is important for thyroid cancer patients? Because of optimizing treatment, reducing side effect, understanding individual response or radioactive sensitivity, risk assessment and follow-up care. And it also mitogenic cancer redeveloped or recurrence like myelodysplastic syndrome, acute myeloid leukemia. And it also causes chromosomal aberration by forming Hurthle cell thyroid cancers. So our objective is investigate the prevalence of dicentric and ring chromosome in thyroid cancer patients before iodine 131 therapy. Analyze it in 131 treatment influences the frequency of those chromosomal abnormalities like dicentric and translocation. Investigates whether the specific chromosomal abnormalities, dicentric, ring, and translocation can serve as early indicator of thyroid cancer. Examines if chromosomal abnormalities can be used to track how well iodine 131 treatment work in thyroid cancer patients. So this is the workflow in dicentric chromosomal and fish assay. Here we draw blood from the patient, that is whole blood, and then isolate the mononuclear cells by centrifuge, and then culture that blood into 48 hours, and the temperature is 37 degrees Celsius, and we add PHA and democolcin solution in that preparation and harvest the cells. We make the cell hypotonic and then fix it and prepare slide and then spread them and stain them and then image and scoring. The image system is meta system, automated scanning and imaging system. Here is our result of dicentric chromosomal assay. The figure found that the frequency of abnormal chromosomes, that is dicentric, before and after iodine 131 therapy. Here we found that the frequency of abnormal chromosomes is increased about 10 to 20 folds after iodine 131 treatment. In this table, we found we want to compare it with the age and the dose. That the DIC formation in age is age independent, but it is proportional to the dose given to the patient. Do dicentric chromosome formation really matters? Yes, it matters because in Nature Communication 2018 October published a paper here and they found that there is transformation of the gene that is the chromosome and telomere fusion or neocentromere formation in the presence of a functional original centromere. Another result is fluorescence in situ hybridization assay, that is FISH assay. Here, the table shows the frequency of the translocation before and after iodine 131 therapy. We are using this for FISH method, DNA FISH probe, red, green, and yellow, and another protein, DAPI, that is DAPI. So, identifying the specific genetic alteration, FISH can help improve the patient outcome and guide personalized treatment strategies. So, why FISH assay is important? Because diagnosis of intermediate thyroid nodule when FNAB results are inconclusive or identify RAT PTC rearrangement, identification of aggressive subtype, monitoring disease progression, and prognostic information. Here we found that this is the rat protein and these are the breaking point, and after breaking point they are forming this rat5 and rat3, and this is the normal, and after breakup it goes apart and making the new protein. So our future plan is integrating the cytogenic assay with clinical follow-up. The cytogenic assays are these four, these five, and we are doing these first two, that is dicentric chromosomal assay and fluorescence in situ hybridization. So by using clinical follow-up, thyroid function test, hematological test, and the clinical features and the long-term surveillance, we can add cytogenic assay and make a better treatment outcome for the patient. Thank you very much. This is our team, and this is the laboratory where we are working with, and this is the patient.